I'm Dr. Narasimhaiah Srinivasaiah. I'm a practicing clinician, a senior consultant in colorectal surgery at Apollo Hospitals, Bangalore. In addition, I'm also the director of Health Sciences Park, Bangalore, which is a training and teaching institution for skill enhancement for surgeons. Our focus at the Health Sciences Park is to drive surgical education via skills enhancement through dry labs, simulators, animal labs, tissue labs and cadaveric labs. In addition, there will be continued medical educational programs to augment and to keep up with the up-to-date knowledge and skill. We will have master classes, conferences ongoing for upskilling medical professionals in addition to upskilling the skill. This sort of facility is not available in India. There are a few centers around the world which do this sort of training and teaching for surgeons. As a surgical tutor in Great Britain, I had a huge responsibility to look after the surgical trainees in the system. In addition, I was privileged to be a nominee of the Silver Scalpel Award, which is a recognition of the best surgical trainer in the country. Coming from Britain, I see the surgical training is certainly fragmented in India. There is a clear disjoint between the academia and the surgical training and practice. There are no universities which are tied up to hospitals until and unless you are working in a medical school with a university attached to it. So a connection between academia and medical sciences will not only help us in coming out with intellectual innovations, but will also translate to intellectual property rights and product developments. So I think it is very important we have a clear connection between academia and surgical sciences, and surgeons have to become thinking surgeons. Surgeons have to become scientific surgeons where they question and then undertake research and translate that into practice. So translational research is not taken much of a leap in India, although we are involved a fair bit in the biomedical research. So I think there is a huge gap in the translational research that is happening in India. So I think we want to bridge this gap from the skill sector, from the academia sector and from translational research point of view, and that is where I think the Bangalore Health Sciences Park will play a role. There are no dedicated cadaveric based training facilities in India apart from one or two medical schools which have cadaveric training facilities, and one of them is here locally in Bangalore. But our intention is to not only bring the dry labs, simulation facilities, tissue labs, animal labs and augment it with cadaveric labs. Add on to that will be virtual reality, which will be incorporated into surgical training, and also augmented reality, Bangalore being the mecca for augmented reality and virtual reality. Artificial intelligence has got a role to play in training, and we are working on it. So the answer is no, there are not many centers of similar nature in the Pan-Asia Pacific region which have got facilities of this nature. Abroad, it is an integral part of one's practice. But in India, academia has taken a back step, mainly because of the commercial nature of medical practice. The medical schools which are associated with big institutions do have some academia going on, but not at a level which can be generalized to the whole country. But there is a huge gap which should be filled and which can be filled with time to come. And I think institutions like us can help to bridge that gap between the academia and the industry and put all the specialities together to come up with a better product and a better service.